We know that the Sustainable Development Goals are based on ensuring a certain percentage of the population has access to specific services or achieves a certain level of social, economic, or physical health. And in this context, geography is very important. When we talk about attaining these goals, it is that X, Y, and Z is achieved everywhere. This necessitates an improved understanding of the subnational geographic variation and inequity in things like health status, wealth and poverty, access to resources. Aggregate information, aggregate statistics can mask hotspots. It can leave portions of the population behind. And so we understand now that this subnational variation is central to targeting the limited resources that we have and meeting the development needs and goals. This requires a consistent, comparable, and regularly updated understanding of how many people are living in a country, where they are, who they are, and how this is changing over time. And of course, doing more with less is very attractive. This means utilizing traditional data sources, as we have done, in new ways, and also integrating novel data sources, which I will talk to you about today. So census data is extremely important in this context, and national censuses continue to be an extremely important data source. Looking at denominators and numerators for all of the SDGs, we can get the requisite subnational detail that we need from a census. We know the complete population, and we can determine how many of those people, for example, fall beneath the poverty line, or our case studies in malaria regions. But the challenge is that within the SDG period, there's typically only one census data point, as we know that they are typically collected every 10 years, and sometimes the release of those data can be 1 or more years. And so the question becomes, how do we define a baseline, and how do we measure change subnationally and regularly from this baseline? In some of the highest burden settings that we focus on in our organizations, the situation is even more challenging. This particular figure here is already outdated. Many countries have not had a census in lots of years. We're working currently with the government of Afghanistan on population estimates. They have not had a census since 1979. The DRC, 1984, and even in countries where we think it would be relatively recent. For example, I work in Namibia. The most recent census was 2011, which already is 6 years out of date. So what kind of data then do we have to help us understand how many people there are, what their characteristics are, and how this is changing over time? Within WorldPop and the Flowminder Foundation, we're utilizing 3 data sources that I'll talk to you about today. Geo-located household surveys, which typically are completed every 4 to 5 years. We use a lot of satellite and GIS data, which is a continuous data source. And furthermore, we use cell phone data now regularly in many of our applications, which again is another continual data source. So these new geospatial data sources can help complement the traditional sources and fill these gaps while maintaining the subnational focus, which is required for the SDGs. So let's start with geolocated surveys. If we look at Nigeria, at an aggregate level, if 53.1% of women are literate, that doesn't give us very much information about where those people are. Being able to look at it at a finer scale, it becomes apparent that in the southern area, there's a greater problem with illiteracy than in the northern area. But increasingly now, we have survey clusters and national surveys using global positioning systems, GPS, to take a measurement of where households are being surveyed or where clusters of households are being surveyed. So for example, the DHS program from USAID, the LSMS program from the World Bank, UNICEF is collecting GPS data on some of their mixed surveys. And what we understand then is a much finer picture of whatever we're looking at. In this case, again, literacy. And we can look at those specific points of where these folks are surveyed and build relationships at those points with data sets that are available everywhere in the entire country. This is just a global picture of where the DHS has surveys, and this is almost every low to middle income country. Satellite and GIS data, massive increases in geospatial data have come out in the past 10 years. Collecting, processing, availability is now here. Folks are crowdsourcing data. They are coming together and digitizing buildings on satellite images and putting them up on OpenStreetMap. UNOCHA, for example, has done some work at looking at refugee camps, incorporating population estimates to see how many folks are there. Increasingly, governments themselves are becoming better at releasing data. This is a road network and health facilities that have come from the government in Kenya. We utilize land use and elevation data from satellite images. These are 50 centimeter by 50 centimeter settlements that have been extracted by an automatic computer algorithm in order to see where folks are living. And interestingly, one of my colleagues wrote a paper in Indonesia improving population estimates using the density of geo-tweets in the area, which gave us just an unprecedented look at where people are. And then cell phone call detail records, which I'm going to call CDRs, call detail records. So mobile ownership as well has skyrocketed in the past decade, and the vast majority of the population, even in the lowest income countries, has at least one cell phone per household. And so what we've seen now in the last 5 years is a rise in CDR applications. These are records that are collected anonymously, and essentially they record the time, type of communication, and the cell tower that the communication was routed through. So for example, if I use my mobile phone right now and I make a call, it will route that through the nearest cell phone tower, and the network operator records the time and tower of my call for their billing purposes. So it will be an outgoing call at their tower. Then let's say I move to somewhere else in Bangkok, maybe I go back to the airport, I make another call, again, it goes through the nearest tower, and over a period of time, what I get, what they get, what I get, what we get is a very detailed picture at an aggregate level of people's movement. And so with millions of subscribers making billions of communications, we can start to see a picture of mobility, which allows us to understand changing densities of people, flows of people. We see very clearly seasonal and permanent migration, which has huge implications for many aspects of our work. Social networks become very important, especially in poverty studies, the number of contacts people have in their calling patterns. And then again, we've also heard mentioned top-up credits, consumption. So credit purchase frequencies and top-up amounts on phones are highly related to all sorts of behavior. So how can we use these newer data sets then? Sorry, I have a stuffy nose. Within the World Pop Organization, we have two means of understanding populations of where people are and who they are. The top-down approach essentially is disaggregating census counts. We move from these irregular census units into 100 meter by 100 meter grid counts by utilizing the remote sensing and GIS data that I showed you previously through a random forest model, essentially because grid squares are easier to work with. Once we can get an estimate of how many people, what their age and sex breakdown is per 100 meter grid square, those data can be summarized at any administrative unit that one is interested in. They are much easier to utilize with other data sources which come at various spatial scales, generally grid counts as well. In addition to the fact that you can take those data, you can utilize them in an analysis with additional data, and then, for example, we have worked on the women of childbearing age per 1 kilometer for the entire African continent in 2015. We've heard a little bit about bottom-up approaches. Now, in certain countries where we cannot disaggregate the census data because it is outdated or it's unreliable, we need to start somewhere else. And so we start with the bottom-up, and essentially we're looking at how can we utilize high-resolution satellite imagery. In this particular case, in Nigeria, we had microcensus data, population estimates per 90-meter grid square. We worked with some folks at Oak Ridge National Labs who were extracting high-resolution settlement types, and we were able to then extrapolate those data to the rest of the province to see how many folks were living in a 90 by 90 meter grid square. But of course we know people don't stay still. And so now within the World Pot Flow Minder organization, we're really focused again on low and middle income countries where data gaps exist. This is an example in Namibia where we work with MTC, the telecom company, to look at population density change per square kilometer over time. And you can see as I flip through here, with the blue being low population density and the red being high, over the course of the year, the population changes quite dramatically from month to month. Folks are either coming into Windhoek and sort of in the middle, or they're moving up into the northern part of the region. And the reason why this becomes important is because let's say that you're understanding the health facility. What is the catchment population in a specific health facility because you want to target vaccination strategies, for example. Depending on what time of the year you plan this vaccination strategy, the number of people within each health facility catchment could be dramatically different. This also becomes really important for disaster applications, for example. If something were to happen in the natural environment in this context, understanding where people are changes rapidly month to month, week to week, day to day. Again, then, the value of mobile phone data is further shown in measuring migration. Again, this is another Namibia example where we wanted to look at what is the annual migration flow from the census data versus the migration flow that we get from the cell phone data to see are these matching in relationship. And we see a very good correlation between these data, which is very encouraging. It highlights a strong potential for ongoing migration statistics produced using mobile phone data. So we've seen in previous slides that the GPS-located surveys can reveal spatial patterns and highlight hotspot areas. So household surveys are also undertaken more regularly than the census. And what we can do is population characteristics measured in household surveys in one area can be related to features that can be measured everywhere, again, from satellite data and GIS and mobile phones. So essentially what we do is build relationships at those points where the household surveys were taken, and we use those relationships to predict the characteristics into unsampled locations across the entire country. It is extremely important in this context to use robust statistical methods and also to be able to quantitatively report the validation of the mapping and the uncertainty in the mapping so that you can see where the model is doing well and where the model is doing not so well. So an example of this is some work that I did in Bangladesh. Here are some survey data, GPS-located survey cluster data. Again, I took data from satellites and GIS data, distance to roads, nighttime lights, vegetation, some climate variables, and then we can see some of the mobile phone data that came from Telenor in Bangladesh, texting counts, the percentage that people use their phones at night. The top right-hand corner is cut off. That's the radius of gyration. That is a representation of how far you move. And weekly top-ups. And what happens then is by building these relationships where the survey points are, we can then predict into the entire country. And I had 3 measures of poverty in Bangladesh. So you can see here at the top The DHS Wealth Index is an asset-based index. In the middle, the likelihood of being below $2.50 a day. And then on the far right, the telecom company had actually done a series of household surveys asking people their income in US dollars. And on the bottom here, these are the uncertainty measures that I mentioned, where you see the model is red. That is a higher uncertainty area. And so the prediction then comes along with an estimation of its own validation, which is extremely important in communicating to policymakers. Again, Nepal, in this particular instance, we could look at things like the brand of folks' phones, what's the width of your screen. These things are related to wealth and poverty, the number of places visited, the number of interactions that you had. These are the types of metrics that produce then maps like this. This is again the asset-based DHS Wealth Index, and if we home into the Kathmandu district, you can see, maybe, yes, a high level of spatial heterogeneity within the cities. We are able to get an unprecedented look at wealth and poverty in cities using mobile phone data because this is based on a tower level calculation, which I'm super happy to talk about more with folks. And these towers in urban areas are as close together as 60 meters. And so that is much smaller than typical satellite data that you could get online. And the work that I'm currently writing up, which is very encouraging, is we're starting to see some of the same mobile phone indicators being important in multiple countries. So what I'm writing up now is how to sort of generalize these analyses from Bangladesh and Nepal and Namibia and Haiti to say if a telecom operator were to, say, release sort of a CDR package of 4 or 5 covariates, radius of gyration, number of places folks visit, interactions per contact, etc., that could be released in an anonymized fashion, which has an immense amount of information on poverty and wealth in an area at this scale. Excuse me. So, yep. Cheers. I got time. Okay, I only have 4 slides left.
All right.
Cheers. So, mapping SDG indicators again. We have the poverty that I've been talking about. These are some applications based on the methodologies that I've discussed that we're doing in the lab. So percentage of people with access to sanitation at 1 kilometer grid squares, percentage of women who are literate at 1 kilometer grid squares. We had a really great tweet about that with the Data 2X recently. They put out a report. Probability of receiving postnatal care within 48 hours of delivery. And then also the resilience aspect of it, risk reduction and adaptation is extremely important. These are some recent examples of mobile phone data usage that we've used in disease applications with the Ebola outbreak in West Africa, with the cholera outbreak in Haiti, and of course everyone knows about the Nepal earthquake. We were actually able to get estimates of flows of people in and out of every district in Nepal within 10 days of the earthquake to all the development people who were in the area because we had previously set up a relationship with NCEL and they were giving us a daily dump of data that we were able to analyze, well, on a nightly basis, actually, as it were. And so this is just to say that these new data sets and these new methods are not crazy academic ideas. They're currently being used to produce health metrics, situation reports, and provide development indicators in many different scenarios. In addition to the fact that we're working with vaccination efforts now, poverty data are available online. And again, the work that we did in Nepal directly fed into all of the relief efforts there. And then this is my last slide. It is extremely important to note that we work with statistical agencies, we work with folks on the ground, because the sustainable part of the Sustainable Development Goals is obviously local ownership and analysis. That is the key to sustainable implementation. So we run training sessions in GIS and remote sensing skills, and all of the data that we produce, both from the covariates, again, from satellites, to the code that we run our statistical models with, are all published and open source and available on our website so that we can make full use of existing data and sort of bring these new data sets in to integrate in a more cost-effective way. I'm super happy to talk about this more. Thank you very much for having me. Cheers.